Hi, I'm Neil Stoner. I'm a physician assistant here at OrthoKnox, and today we're going to be talking about frequently asked questions in postoperative care of our shoulder replacement patients. And we're going to be talking both about reverse total shoulder replacement as well as standard total shoulder replacement. The first question that we'll talk about is, when can I drive after surgery? For most patients, we like for you to wait at least 2 weeks after surgery prior to driving. You also have to be off of any narcotic pain medicines in order to drive. And finally, you have to be comfortable driving in a sling. Next question that we get commonly is, how long will I be in a sling after surgery? For most of our shoulder replacement patients, the duration is about 6 weeks that you're in a sling. The next question that we commonly get is about going back to work. For most patients with a desk job type work, most patients are able to go back at 2 weeks. Although if the dominant arm is the one in the sling, that can make it a bit more difficult to go back to work. If you're in a more manual labor type job, we commonly want you to be out of the sling, so at least 6 weeks, sometimes 8 weeks if you have a more demanding job. The next question we commonly get is, when do you start physical therapy? For that, you will start in the hospital after your surgery, and then you'll start outpatient physical therapy within a couple of days of getting home. And that will go for about 3 months after surgery, typically 3 to 4 months. The next question that we commonly get is about showering. Have a waterproof dressing on after your shoulder surgery, and you can shower immediately from getting home from the hospital. You just have to pat that dressing dry with a towel, and that dressing will stay on for 2 weeks from your surgery, where a provider will take it off here in the office. The next question we get is about when to call our office. The reasons to call our office would be for things like excessive drainage into your bandage, temperature greater than 101 degrees, or a general ill feeling. If you feel like you're sick, then certainly don't hesitate to call our office, and one of our providers will give you further instructions. Another question that we get is, how long will your surgery take? For our shoulder replacement patients, surgery commonly takes between an hour and a half and 2 hours to complete. Finally, a common question that we get is how to get the best result from your surgery. And for that, I would tell you 2 things. First is to stay in your sling until we allow you to come out of it. Most patients' injuries after surgery happen when they're out of their sling doing something that they may not think would cause much of a problem. And lastly, to listen to your physical therapist. They're there to help guide you in the process, and they're there to help you get the best results. And any therapist will do a great job for you, but especially the therapists here at OrthoKnox.